I want to kick off with what's happened in Germany. Why was Germany so good at testing and ultimately the poster child for controlling the pandemic in the early days, but now proving relatively disappointing when it comes to the vaccine rollout?
Well, Germany was indeed, I think, quite well equipped for the early stages, but it's less well equipped for the current situation, that is getting vaccines as fast as possible into the arms of the people. This is a federal state, and each federal state of Germany has this responsibility. And apparently preparations were good, but was still suboptimal in getting this done as quickly as possible. And obviously also some people are hesitant against vaccination, and that may also influence the situation.
Well, I want to pick up on that last point, in particular with regards to the AstraZeneca vaccine. Clearly, there is a lot of hesitance, not only in Germany, but across the European region around taking the Astra vaccine after European politicians effectively introduced some doubt around the vaccine, with the French president calling it quasi-ineffective, which was a baseless claim. It was just about having insufficient data for the older population. I'm curious if you think it's possible to restore faith in the AstraZeneca vaccine at this point, and if potentially getting more data out of the US with trial data due in the coming weeks, if that could do the trick.
Well, I assume there were a couple of factors that influenced the attractivity of the AstraZeneca vaccine. First of all, there's a strong competitor from Germany, BioNTech, which of course is done with Pfizer from the US. Second, the phase 3 clinical efficacy trial with the AstraZeneca vaccine, in my opinion, was also suboptimal. There were a mix-up of doses and others. And then there were also some fake news about it, which was that there was this claim that only 8% protection could be achieved in the elderly, which is totally wrong, because there were no data on the elderly until then. And then because there were only few data or no real solid data on efficacy in the elderly from the phase 3 trial, our advisory committee decided to only permit injection up to 65. This may change and will change soon, because we now have these extremely helpful and great data from Scotland that show in a real life situation the vaccine from AstraZeneca gives very, very strong protection against hospitalization, and that is what you need, that is severe disease.
When the UK announced at the beginning of January that they were going to start spreading out the first and second doses to a 12-week interval, it was met with a lot of skepticism from around the world. But if you look at the initial data, it's actually proven to be a strategy that is working, because so far the efficacy after just one shot seems to be pretty high. Now, the Europeans so far don't seem to be taking on that approach, specifically France. They're still going down the 2-dose regimen before rolling it out to the broader population. Do you think that it would be beneficiary for Europe to adopt the same approach that the UK are taking with spreading out the first and the second jab here?
Well, as an immunologist, I would say there is no great risk in delaying the second shot. That is the booster shot from the prime. But after all, this is a vaccine that has some impact on your health and on your immune system mostly, and therefore we have to follow the recommendations that have been made. And often this is the case, at least in Germany, you are rather stringent in your first recommendation, and later, when more data are rolling in, you may open it up. So I understand the decision, but I think it's now time, on the basis of the new data, to go on and reconsider this. And I'm sure that will be done very, very soon now, both with respect to age limitation, that is only under 65, and also with the prime boost regimen, that is the first and second shot.